Good morning, everyone. I, Aditya, from BSc Chemistry Honors third year, is today here to give the presentation on my topic, and my topic is drugs. Drugs are the low molecular mass, generally 100 to 500 AMU chemical substances which may or may not have the therapeutic use. That is, may or may not be used in the prevention, diagnosis, treatment of diseases are called drugs. There are two categories in which divided the drugs, which are medicines or chemotherapeutic drugs or the poisons. The medicines are the low molecular masses chemical substances which have the therapeutic use, that is, that can be used in the prevention of diagnosis and treatment of are called treatment of diseases, whereas the poison is the low molecular mass chemical substances which have no therapeutic use, which are used are known as poison drugs. Drug act as medicine when it is taken in the minimal or the prescribed account, whereas the poison when taken in the excessive account. Chemotherapy. It is the science of the curing the diseases by the use of chemicals is known as chemotherapy. The basic approach of the chemotherapy is that it is used to attack or destroy the microorganisms without harming the tissue of the human body. Now the question arises, when the drug act as medicine. Any drug can act as medicine when their biological response is therapeutic, that it can be prevent, diagnosis and treatment of curing a disease. Now let's see what is the characteristics of a drug. It should be non-toxic. It should have the minimum side effect. It should not injure the host tissues. It should be efficient. It should not host the resultant to the drugs after that for use some time. All the above mentioned characteristics are not present in all the chemical drugs. So we have to make the different type of drug which will be suitable according to the diseases occurring. Now see what are the target molecules. The target molecules are the biomolecules like lipids, proteins, nucleic acid, etc. that are derived in the certain metabolic pathways by interacting with the receptors and leading to a certain diseases whose activity is inhibited by their interaction with the drugs are known as target molecules. Now see what is receptors. Receptors are the enzymes or the proteins which are embedded in the cell membrane and are crucial for the communication system in the body by receiving the chemical messenger released by the target molecules or the drugs. What are chemical messengers? The chemical messengers are the chemicals which are released by the target molecules or drugs and give the message to the cell without entering in the cell and are referred as the chemical messengers. Now we have discussed about receptors and chemical messenger. Now see what are the enzyme inhibitors or the analgonists. The drugs which directly or indirectly binds the receptor site and inhibit the growth of the natural function, that is to prevent the binding of the drugs with the receptors, are called as antagonists. They are used when blocking of message is required. What are agonists? Agonists are the drugs which maintains the natural function in the absence of the natural messenger are called agonists. Now see what are the type of the enzyme inhibitors. They can be of two types, the competitive and the non-competitive. Now see what are the mechanism of the chemotherapeutic action. First of all, let's see what is biological defense. The infecting organism manufacture the antigens in the body simultaneously, and the body manufactures antibodies to fight against the toxic antigens. The biological defense in the engulfing the microbes by the leukocytes. Similarly, when antitoxins, which are not the viral antibodies, neutralize the toxin specific for a disease, the vaccines are the devitalized disease organisms which upon administration stimulate the body to manufacture the antibodies to define against the disease. Now let's see the classification of the drugs. First of all, we see the classification of the drugs on the basis of their physiological action. First one is antipyretic. The chemicals which are used to bring down the body temperature in high fever, bring down the temperature in the high fever are known as antipyretics. These generally cause a lot of perspiration. Example of the drugs are aspirin, paracetamol, phenacetin. Now see what is paracetamol. It is also sold in the market in the names like crocin, comviflam, etc. The paracetamol, it is an acetyl derivative of the para-aminophenol, and it is an antipyretic and analgesic. It is sold as crocin, combiflam, calpol, metacin, dol-4, zymol, and widely used medicine across the different countries. Now see the synthesis of paracetamol. It is generally synthesized by the para-aminophenol by adding a acetic anhydride in it, and after a result the acetic acid will be removed as a side product, and our paracetamol is prepared. Now see the next drug, that is aspirin. It is used as an antipyretic, analgesic, and antirheumatic. It was the first introduced as a medicine by a dresser. Preparation of the drug is it can be prepared by the acetylation of the salicylic acid using acetic acid or acetic anhydride in the presence of H2SO4, or with acetic anhydride in the presence of pyridine to maintain the basic medium. However, the precautions we have to take by taking the aspirin are the that we can't take it empty stomach, because it undergo hydrolysis to give the salicylic acid, which may cause the peptic ulcers and bleeding, and finally may cause to death inside the stomach, because the minimal layer of the mucus will destroy out and our stomach get infected. Now let's see. Aspirin reduces the chance of blood clotting by suppressing or decreasing the production of the prostaglandin hormone that causes the blood clotting, and thus aspirin can prevent it from heart stroke. So there is an opinion above aspirin that take aspirin a day keeps the doctors away. Hence, aspirin is also known as wonder drug in the Harvard University. Aspirin is the world's first synthetic drug. It is sold under the name Disprin, Microphyro, Winsprin, Acebuf, etc. across different countries under different names. Now see the second type of classification, that is anti-inflammatory drugs. The drugs which are used to reduce the inflammation or swelling are called as anti-inflammatory drugs. It make up above half of the analgesic, remedying pain by reducing inflammation, and opposed by reducing the which affect the central nervous system to block the signaling of the brain. Now see the next drug, which is ibuprofen or the brufen. It is analgesic and a weak headache inflammatory action. It is a white color powder insoluble in water, and its analgesic action is less than that of aspirin. So it is not so effective as does the aspirin does. It is used to relieve the muscular pain, toothache, joint pain, and used to cure an rheumatoid disease and an antihistamine disease. Preparation, it can be prepared by using the isobutyl benzene acylation followed by their reduction by hydrogen iodide in the presence of red phosphorus by the acidic hydrolysis. Now see the next type of drug, that is antimicrobial drugs. The chemicals which are used to kill or stop the growth of the microorganisms are called as antimicrobial drugs. The type of antimicrobial drugs are differentiated on the basis of their effect. First type is seedal antimicrobial drugs. The chemicals which are used to kill the microorganisms are called as seedal antimicrobial drugs. Example are olflexin or aminoglycosides. The second type is static antimicrobial. The chemicals which are used to stop the growth of microorganisms are known as the static antimicrobial. The example includes the tetracycline and chlorophenicol. Now see the type of antimicrobial drugs on the basis of their action. First one is the antiseptics, the chemicals which are used to prevent or destroy the growth of the harmful microorganisms but are not to be toxic for the living tissues. The use of antiseptics are: it can be applied on the cuts, wounds, ulcers, and infected skin. They are also used to reduce the foul smell of a body in the mouth due to the decomposition of the bacteria. These the compounds are present on the face powders and decorate breath and deodorants and breath purifiers. First of all, example is Dettol. It is a mixture of the chlorhexylenol and tetraphenol. And second example is the chlorine. It is used to kill the germs in the water to make it fit for the drinking purposes. Now see the next second type, which is disinfectants. These are the chemicals which are capable of completely destroying the microorganisms causing diseases but are also harmful for the living tissues are known as disinfectants. The same substance can act as antiseptic as well as disinfectant defect on the concentration of solution. Example, the 0.2% of the phenol antiseptic is an antiseptic, but the 1% solution above phenol is known as the disinfectant. Hence, the concentration depends the type of the drug. Now, see the next type, which is antibiotic. Example of the drug is the povidone iodine, sold under the name the betadine in the market. It is a water-soluble compound which is a combination of a hydrogen iodide, molecular iodine, and the polyvinyl pyrrolidine. It is used as an antiseptic irrigant. The povidone iodine epithalamic solution is very effective before and after the ocular surgery at the birth and for the some forms of conjunctivities. It means when the joints are broken. The use of the povidone iodine in the epithalamic practice continues to reduce the incidence of the blindness to children and adults throughout the world. It is not the recommend for the use of thyroid gland and for the more than 30 and less than 32-week pregnant women. Now see our next drug, that is sulfur acetamide. It is the sodium salt of the sulfur acetamide and used in the eye infection under the name locula. Its solution is used for the ophthalmic infections. It is generally used in the tract infection because it has the high solubility in water and thus can easily excreted through the urine without the danger of the kidney damage. It can also be prepared by the acetylation of para-aminobenzene sulfonamide followed by the mild hydrolysis of it. Now see the next drug of the class, antifungal drug. It is a antifungal drug, namely the undanilic acid. It is insoluble in water. It is a viscous yellow liquid with the characteristic odor. It can be prepared. It can be prepared in the laboratory under the pyrolysis of the compound, namely the depth of phatic infections. See the next drug, which is the anti-amoebic drug. Example is metronidazole. It is an antibiotic, anti-amoebicide, and anti-protozoal drug. It is used for the treatment of the resaca in the treatment of the moldral fungating wounds. Now see the next category, which is known as the anti-malarial drug. The chemical which are used to bring down the body temperature during the malaria fever are called as the anti-malarial drugs. Example includes quinine, chloroquine, arelin, paraquilene, and primaquine. Chloroquine. It is a very active example of the drug is the chloroquine. It is a very active against the diseases and falciparum bacteria. Its activity is 3 to 4 times than that of quinine. Now see the next drug, that is anesthetic drugs. These are the chemicals which causes the unconsciousness in a part of body or in the whole body by their action. Types of the anesthetic drugs are the general anesthetics and the local anesthetics. General anesthetics are the chemicals which cause the unconsciousness in the whole body. They are given at the time of the major surgical operations. Example: the gaseous forms of nitrogen oxides are also known as laughing gas and ethylene, cyclopropane, liquid form, chloroform, diethyl ether are the example of this type of drug. The second category is the local anesthetics, the chemical which causes the unconsciousness in a part of a body. They are given at the time of minor operations. Example includes the pressine, ethyl chloride, and the oxyquin. Now see the benzosine. It is an ethyl ester derivative of the para-aminobenzoic acid and prepared by the oxidation of the para-nitrotoluene with reduction with hydrochloride. It is used as an anesthetin. Now see the next class, which is known as the antibiotics. The chemical which are produced from the one microorganisms and are used to kill and inhibit the growth of the same type of other microorganisms causing disease are known as antibiotics. These are effective in the treatment of the infectious diseases. For example, the penicillin is the first antibiotic which is obtained from the mold Penicillium natitum bacteria and was discovered by the Alexander Fleming in 1929. It is an effective drug for the pneumonia, bronchitis, abscess, sore throat, and the diseases that are caused by the same bacteria. Example includes the tetracycline is used against the active phenophuer trachoma used in the urinary tract infections, or the chloromycin is used against the typhoid, meningitis, pneumonia, diarrhea, and dysentery. Now see the what are neurological active drugs. These are the chemicals which affect the central nervous system, and the types of the neurological active drugs are analgesics, tranquilizers, and anesthetic drugs. Now see what is analgesics. The chemicals which are used to reduce the pain with or without using the consciousness are known as the analgesics. Types of analgesics are narcotics and non-narcotics. Narcotics are the chemicals which are used to reduce the body pain along with the consciousness. Example: morphine and codeine. Morphine, it is an alkaloid obtained from the unripe seed capsule of the poppy plant, and it is a powerful analgesic. The major stack of the pollen is that it is a drug of addiction. It means that it can't be taken in the major amounts. Now see what are the non-narcotics or the mild analgesics. These are the chemicals which are used to reduce the body pain without causing the unconsciousness. Example includes aspirin, we have seen earlier. Now see that why the narcotics are mainly used. The narcotics are the mainly used for the relief of the post-operative pain, cardiac pain of the turmeric cancer, and in the childbirth pain. Now see what are tranquilizers. These are the chemicals which act upon the central nervous system and reduces the mental tension or depression are called as tranquilizers. There are two types of tranquilizers which are known as hypnotics or sedatives, or the mood elevators or antipreventives. Sedatives are the chemicals which reduces the mental health tension and promotes the relaxation are called sedatives. Derivative of the veronal, amytal, nimetal are the example of the sedatives. And the mood elevators are the chemicals which reduces the depression are called as the mood elevators. Example includes phenelzine and benzedrine. Thank you.